Alright, so I'm going to do this again. I keep doing it. I'm in the car and it did something funky. So anyways, I had my pre-op appointment earlier this week. I just want to kind of go over some of the things that we talked about. They had a checklist of like a bunch of things they covered. It was pretty detailed appointment. In the checklist, they covered things like steps in terms of contacting the surgery center, making sure I know when payment is due, making sure that I have the contact information for them, making sure that if you need clearance from any doctors, any specialists to be cleared for surgery, that you have all the forms for that. I talked about some of the medications that you need to stop taking 2 weeks before. So things like vitamin E, what else? Vitamin E, fish oils, and things like that. I think they have some medications can affect the healing process, blood clotting process, and so forth. So we cover that. Also, prescriptions for the things that I would need post-op. Talked about what I would be taking, and they wrote a prescription and sent that over. So my doctor uses a medicated eye drop, and I think it has a steroid and it has an antibiotic and stuff all in one. Also, he talked about the post-op guidelines. Do not, they don't want you to bend over for a couple of weeks. Sleep and recline or sleeping with pillows on your back. Not using creams and stuff. I think for 2 weeks or up to 11 days. So 11 days is like the magical day when I guess everything typically is okay in terms of being able to return back to normal activities. Going over some of the equipment, or not equipment, but the things you'll need for post-op care. So lubricating eye drops, they want you to have that. Icing, so I'll be icing for 2 or 3 days at first, and they gave some suggestions on that. You can use frozen ketchup packages because they're small and they're not really heavy. Or for me, I ended up purchasing some small round cold packs. So they're probably actually they're rounder than this, but they can be frozen or they can be warmed. And the reason why I did this is because I think after 3 days, then you use a warm compress. So they did mention you can put rice in a sock and warm that up, and or I can use the warm compress. So I have some options at least. I think I've also heard you can probably put like some frozen peas and carrots. So if need be and that doesn't work, I'll probably put some of those in like a small sandwich bag and just, cover that and cover the area first so I don't get frostbite. Um, yeah, the how to apply the eye drops. I think I'll be putting the medicated eye drops in like 3 times a day. So they mentioned that either I could lift the top lid since I'm having a lower blepharoplasty. I don't want to touch the bottom area, or I can lay back and tilt my head back and put the eye drop like in the inner corner, and then let it roll into the eye. Let me think of what else. And so, of course, they talked about when I'll be finding out the time for the surgery. And that's something that I won't find out until like the day before. Um, the Let me think of what else. So post-op information. They already have me scheduled for my post-op appointment. So there's one that's like maybe 7 days, maybe a week or two later, and then I have one at the 3-month check. Then the doctor came in, examined my eyes again. He went over the procedure, explained how he'll be, you know, correcting or fixing the lower eyelids. So he'll be making an inner incision, and he'll be cutting, excising, I think, which is removing the excess fat until it comes flush to the occipital bone area. So, or occipital rim, I think. So, we talked about that. He went over the risk, went over the benefits of having a procedure. He also mentioned, that this is the only way to fix these areas, that alternative options will not work in my case. He showed me the pictures that he had taken before to show the areas that he will be working on. And let me think of what else. Of course, like I said, he did an examination again. He normally does a thorough examination of having you look up and down. They check your vision, have you looking around. He's touching the areas and all that stuff. And just he answered any questions I had, which I have had a couple of questions. And so it was a pretty good appointment. I think it lasted like an hour. I feel comfortable, ready to proceed. Because of my cardiovascular history, I did end up telling him I wanted, just make sure to get clearance from cardiology. I didn't think it'd be a problem, but I don't want any issues to come up the week of the surgery. I also paid for his portion of the money. Right now it costs the total is going to be $5,300. So I think $41.50 or something like that was due to him. The remaining amount will go to the surgical center. And so for him, his policy for now is that if the surgical center has a different price, or say I have to be under general anesthesia for longer than the period that is allotted, that he will pick up the charge on that. Just another quick thing that I was really, really happy about. I found one of his former patients. I was on his Instagram business page and saw that they commented on their own before and after pictures. And so what I liked about her comment, because I was, they have before and after pictures, but it's not the same as like actually speaking to somebody, and then you also don't know, how is this person happy? Were they happy? They might have been happy with the results, right after, but maybe they're not happy anymore. Maybe a couple of years go by and, they realize it was a mistake. I've seen some videos where people have said that. Or maybe they weren't happy with their results at all, even though he has the before and after pictures. So I did reach out to one woman because she said that the pictures didn't do justice to her results. And we had a long conversation going back and forth on Instagram. She was really happy with her results. She said she's still happy about them. She said that she looked worse in terms of recovering. She looked worse than she looked. So, she took Tylenol, but she was fine. And so that's another thing that I've done, I guess, for my pre-op for me, is just trying to reach out. So I think, that I've done as much due diligence as I can. Like I mentioned before, he has all the credentials. This is what he does all day. And some of the things that he mentioned, like doing the incision inside, there's less complications for that. It's more difficult, but it's less complications in terms of retraction of the eyelid and then healing when you do it on the outer lid, especially for people of color. It's preferred to do it inner lid, but if you do it inside, then you have to have another surgical management. So anesthesia, you can't do local or something like that. You'll need to be probably put under general anesthesia, or at least, very least, MAC, which is when they monitor you and you're still asleep, but you're not, that you're breathing on your own and stuff. So he said the best way, though, to make sure that, somebody doesn't wake up or they feel pain and stuff, is to put them totally out. So, trying to think of what else. I feel, ready, nervous still, but I think I've done what I can, and I'm just, ready to go in. So that's all I have for now. We will talk later, or I'll talk later. I'll try to do a video probably after the surgery. All right, bye bye.